Thank you, Chair. If I may address Sir Martin in the first instance, or Professor Martin, just regarding some of those points, how would you address some of those concerns that have been raised? And I'd also like to ask about where you think the next 10 years is going if we didn't do this, in terms of being able to cure things like cancer and other things. I'll also just refer members to my register of interest and also to articles I've written over the past year or two, being very pro digital health and use of data. But I'd be keen to get your views as a rebuttal, I suppose, to those points, please.
Yeah, I mean, thank you very much. I don't think that this is at all like where we were in 2014 with care.data. You can perhaps ask Nicola Perrin that same question. She had, as Phil has pointed out, she had a role, a different role at that time. Why don't I think that? Well, I think NHS Digital as an organisation is substantially more, if I put it, professional in how it deals with data requests and data distribution and all the areas we're talking about. It has, there are detailed application forms that have to be made. It has an independent group advising on the release of data, which is chaired by a layperson, has one other lay member, has somebody who is a health ethics expert, an epidemiologist, and 3 GPs. It also, in this new scheme, there would be a professional advisory group, essentially a GP group in addition. So is already an independent group advising on data, release of data. They publish, they meet every week, in fact currently twice a week I gather because of COVID. They publish all their minutes, and NHS Digital publishes a log of all the distributions of data that are made, which is quite different. All of that is quite different to where things were in 2012, 2013 and so on. So a lot has changed. Could it be better? Yes, substantially. To find this information, you have to be looking for it. So it's, I mean, it is there, it is on all their website. It's not the most accessible information, and so on and so forth. So I think that there is additional work that could and should be done, and communicating this has been challenging. And I think that the communication over the last 3 months has not been anything like what it should be, and it would be interesting to hear from those who are closer, from the government side, if you like, on both the lessons, on their reflections on communication, the lessons learned and plans going forward, because I would want to see that substantially better. I think that it is worth drawing a comparison. What we're talking about today is GP data. One of the points that's made was it contains terribly sensitive information. Well, yes, it does. But I think we should think very carefully about making that statement as if that's a bad thing. Depression is a terrible condition. It's potentially a sensitive medical issue. Stillbirth is a terrible thing. It's a potentially sensitive medical condition. Sexually transmitted diseases are certainly sensitive. If all those data were excluded, what would be the impact? The impact would be a loss of ability to find new treatments or manage those conditions or develop the healthcare services that are needed in order to treat those very conditions. And I am reminded of the HIV epidemic, as it was considered at the time, back in the late 1980s and early 1990s, when exactly these sorts of issues were considered to be so sensitive that there shouldn't be data sharing and that there should be substantial cautions around HIV tests and so on. And actually it was the HIV community who turned round and said, hang on a minute, you're actually discriminating against us and excluding us from the opportunity for our needs to be met. So I think one needs to balance some of those issues. And I think just saying that a particular issue is in some person, I think the word that was used was taboo, I think is that's a judgment call, which I don't think anybody on this call today or in this meeting today is in a position to actually make for themselves.
Okay, thank you, Dean. Come on. Yeah, carry on, Dean.
Sorry, I just wanted to ask Dr. Perrin the same question. So in terms of your take on the statements earlier, but also what's the risk of not doing this?
Thank you. So I would agree with what Martin has said. This isn't where we were with care.data because of all the safeguards that Martin has just been through. So I think it's wrong to say that lessons haven't been learnt. And I think the National Data Opt-out Programme, when that was implemented in 2018, did demonstrate that the lessons had been learnt very thoroughly. There was a lot of involvement with patients, testing, retesting, getting the wording absolutely right so that people really understood the information that they were being given so they could make an informed choice. So I think we were in a very different place. What has gone wrong this time? I think the obvious thing is not enough communication, and that's really frustrating because at the beginning of last year, I was in a meeting with people from the programme team and NHS Digital, planning a programme of comms and engagement over a nice length of time to really take people with them and co-development. And that stopped because of COVID. The whole thing was put on hold. But then I think COVID has also had an impact on what then happened with the comms, because I think partly time had been lost, and because COVID has really demonstrated just how important it is to have data, there was a real feeling of urgency, and you couldn't wait another 12 months to get the programme right. So that urgency led to the restart much quicker than perhaps people were ready for. And also a feeling that people would be more accepting now, that there'd be less critics because people understood that data was important. And clearly that was wrong, and it's been proved to have been the real issue, I think. But I think the other piece in there is that the level of mistrust at the moment isn't just about use of GP data. It's much wider distrust in the system as a whole at the moment. People do still trust the NHS, but the thing when people have been talking about a sinking feeling and feeling like we're back to where we were in care.data days, I think we're in a slightly different place, and it's a place that I'm actually much more worried about, because for the first time people are aware that this data collection is happening and they really get the benefits, and they're saying we absolutely support the use of NHS patient data for research and planning to help the NHS. We get that, we support that, but we just don't believe that that's the only use of the data that's going to happen. And that's the piece that's really concerning, that the safeguards aren't being talked about enough so that people don't trust what else the government is going to do with the data. And
so just to clarify on that, and I'm conscious I know many other committee members wanted to come in, so I'll be brief, but would you say then that is the mistrust misplaced?
I would say that the mistrust of what NHS Digital has in the way of safeguards, particularly with the new announcements of TREs, is misplaced. So I think the safeguards are there, and Healthwatch England have released their polling data today, and that shows that people have a very high level of awareness of the data collection. They have a high, what they think, understanding of what's involved. When they've been shown NHS Digital's information and video explaining what's happened, nearly half of them have said that the two things, the stories they've heard in the media and what they're hearing from NHS Digital, just don't match up. So I think there is a real problem with misinformation about what safeguards are there. And that is why a really on the front foot comms campaign, information campaign with full engagement is going to be so important.
Thank you. Thank you. I'm going to move on because we've got lots of people who want to come.